I want to show you something that most doctors never take the time to demonstrate during an appointment, even though the research supporting it has been published in some of the most respected cardiovascular journals in the world. It takes less than 5 minutes. It costs nothing. It requires no equipment, no prescription, and no previous experience. And in adults over 60 with elevated blood pressure, it can produce a measurable, clinically meaningful drop in systolic pressure that begins within minutes. I'm talking about controlled breathing, specific structured breathing techniques that activate a branch of your nervous system far more powerful than most people realize. A branch your blood pressure medications are not directly targeting at all, and one you have complete voluntary access to right now, wherever you are sitting. I'm Dr. Matthew Carter, and before you dismiss this as sounding too simple to be serious medicine, I want to explain the physiology behind it. Because understanding why these techniques work is what separates people who try them once and forget about them from people who use them consistently and see meaningful long-term results. Your cardiovascular system is regulated by two major branches of the autonomic nervous system. The sympathetic nervous system, often called the fight or flight system, increases heart rate, tightens blood vessels, and raises blood pressure. The parasympathetic nervous system, often called the rest and digest system, does the opposite. It slows the heart, relaxes blood vessels, and lowers blood pressure. In adults over 60 living with chronic stress, poor sleep, sedentary habits, or persistent anxiety, the sympathetic system often becomes dominant. The body settles into a low-grade state of chronic activation. Blood pressure stays elevated not because of immediate danger, but because the nervous system never fully shifts back into recovery mode. And here's the critical insight. Your breathing is the only automatic bodily function that is also under conscious voluntary control. You cannot directly command your kidneys, immune system, or heart rate, but you can control your breathing. And when you breathe slowly and deliberately in specific patterns, you directly influence the autonomic nervous system in real time. You stimulate the vagus nerve, the primary communication pathway of the parasympathetic system, triggering measurable physiological changes that include reduced heart rate, relaxation of blood vessels, lower stress hormone output, and measurable reductions in blood pressure. This is not vague relaxation. This is documented cardiovascular physiology. A major review published in the Journal of Human Hypertension found that slow breathing exercises produce significant reductions in both systolic and diastolic blood pressure in patients with hypertension. The American Heart Association has formally acknowledged the evidence supporting device-guided slow breathing for blood pressure management, and researchers at the University of Colorado found that just 5 to 10 minutes of slow breathing daily lowered resting systolic blood pressure by an average of 9 points over 8 weeks in middle-aged and older adults. 9 points. That is a clinically meaningful change, equivalent to what some low-dose blood pressure medications achieve, without side effects, without prescriptions, without spending $1 at the pharmacy. I want to walk you through 3 techniques today. Each works slightly differently, each has solid research behind it, and each can be learned in the time it takes to watch this video. The first technique is called diaphragmatic breathing. This is the foundation of everything else. Most adults, especially older adults who spend a great deal of time sitting, gradually drift into shallow chest breathing. Chest breathing uses only the upper portion of the lungs and tends to keep the sympathetic nervous system subtly activated. Diaphragmatic breathing, often called belly breathing, engages the diaphragm, the large dome-shaped muscle beneath the lungs. When the diaphragm moves fully, it activates stretch receptors deep in the lungs that send calming signals directly to the brainstem. That increases parasympathetic activity. Here's exactly how to do it. Sit comfortably with your back supported. Place one hand on your chest. Place the other hand on your stomach just below your rib cage. Now inhale slowly through your nose. Your goal is for the hand on your stomach to rise before the hand on your chest. If your chest rises first, you are still breathing shallowly. Once you feel your stomach expanding naturally, begin adding a controlled exhale. Breathe in through your nose for a count of 4. Then exhale slowly through softly pursed lips for a count of 6. The longer exhale matters. Exhalation activates the parasympathetic system more strongly than inhalation. Extending the out-breath deepens the calming cardiovascular response. Practice 10 to 15 cycles. Most people notice a clear sense of physical relaxation within 3 to 4 minutes, and with daily practice over several weeks, the nervous system begins establishing a calmer resting baseline. The second technique is called resonance breathing. This one has some of the strongest blood pressure research behind it. Resonance breathing, also called coherent breathing, uses a very specific breathing rhythm, about 5 to 6 breaths per minute. At that rate, your breathing synchronizes with a cardiovascular rhythm called heart rate variability. Heart rate variability reflects how adaptable and resilient your nervous system is. Higher variability is associated with lower cardiovascular risk, better stress resilience, and healthier aging. Low variability is associated with hypertension and chronic stress. When you breathe at this resonance frequency, heart rate variability improves dramatically. Researchers have found this creates a stabilizing effect on the cardiovascular system itself. A study published in Hypertension Research found that 6 weeks of daily resonance breathing reduced systolic blood pressure by an average of 14.5 points. That is not a minor change. That is a result many medications would consider highly successful. Here is how to practice it. Inhale slowly through your nose for a count of 5, then exhale slowly for a count of 5. That creates one full breath cycle every 10 seconds, which equals 6 breaths per minute. No straining, no forceful breathing, no breath holding. Just smooth, continuous breathing for 5 to 10 minutes. Many people find it easiest to use a simple breathing animation online at first. After a few sessions, the rhythm becomes natural. I recommend practicing resonance breathing twice daily, once in the morning before checking blood pressure, and once before bed. The morning session helps establish a calmer baseline for the day. The evening session helps discharge accumulated nervous system tension. The third technique is called extended exhale breathing, and this is the most powerful technique for rapidly lowering stress-related blood pressure spikes in the moment, before a stressful phone call, before a doctor's appointment, or anytime you feel physical tension rising. This technique works through something called respiratory sinus arrhythmia. Your heart rate naturally speeds up slightly during inhalation and slows during exhalation. When you deliberately lengthen the exhale, you amplify that slowing effect. You are essentially strengthening the vagal brake on the cardiovascular system. Research published in Frontiers in Human Neuroscience found that exhale-focused breathing produced some of the strongest immediate reductions in sympathetic nervous system activation. Here is the technique. Inhale slowly through your nose for a count of 4. Then exhale slowly through parted lips for a count of 8. Double the exhale length compared to the inhale. If that feels comfortable, you can eventually progress to 5 seconds in and 10 seconds out. Repeat for 10 slow breaths. Most people notice a physical shift within the first several cycles. The shoulders soften, the jaw relaxes, the heart rate slows, the body begins settling. That is your nervous system responding in real time. Comment below right now with one of 3 responses. Comment, trying this today if you are going to practice one of these techniques before your next blood pressure reading. Comment, already breathing, if you already use breathing exercises and want to share what has worked for you. Or comment, want the numbers, if you would like a deeper video covering the clinical research behind these techniques. I read every comment, and if someone you care about struggles with blood pressure and has never been shown these tools, please share this video with them today. It costs nothing to try, and the evidence supporting it is genuinely impressive. I'm Dr. Matthew Carter. Subscribe now, because next week I'm covering the 5 blood test markers that predict cardiovascular and cognitive decline years before symptoms appear, including one marker many doctors never routinely order. Take good care of yourself. Your nervous system is more powerful than most people have ever been taught. You just needed to learn how to use it.